Good morning or good evening, ma'am. So we are group 5, amino acids. We're here to discuss about the glucometer, how it's used, what is it for, and some patient counseling afterwards.
Good day. This would be all about the illustrative parts and applications of the glucometer. A glucometer set includes the glucometer itself, the Lancet device, and the test strips. Glucometer is usually smaller than a cell phone, and it is considered as the brain of the system. In this instrument, electric impulses are converted into blood sugar levels. These electric impulses are generated after blood reacts with the enzyme in the test strips. Another would be the test strip. It is a thin, flexible plastic strip measuring between half an inch and an inch long. They are designed to absorb a small blood droplet for analysis by the meter. Sandwiched between the plastic top and the bottom are enzymes that react with blood drops placed on it. Now, this would be a great reminder that these strips can be used only once. And lastly, we have the lancing device, or also known as the glucometer lancet. This has a spin-loaded mechanism and comes in a pen-shaped device. It is used to prick your skin for blood. Now we go to the parts of the glucometer, which includes the test strip slot, the LCD screen, and the button. On the test strip slot, it is the part of glucometer where the test strip is inserted. On the other part, the LCD screen allows individuals to see how actually blood glucose reading compares with historical records stored in the meter and show how individuals stay within their specific target range so that they can determine how well they're controlling their diabetes. And the button allows quick and correct measurement of blood sugar levels. Next, we go to the Lancet device. The Lancet device has its pull rod where you just need to twist the cup and pull it out before inserting the Lancet needle into the pen while testing. Pressing the Lancet button will let you easily prick the skin and get a drop of blood. Now, the Lancet portion has a knob section and blood collection depth on one end, letting and protruding Lancet cutting edge section on the other end. The adjusting allows you to adjust the Lancet depth or penetration. And lastly, we have the test strip. The strips work with glucometers to read your blood sugar levels. Now, knowing your blood sugar levels help you to manage your disease. These strips are connected to the device on one end and collect a drop of blood on the other end. This is to display the blood sugar level instantly on the screen on the glucometer device. Now, with all the parts discussed, we go to the application of the glucometer. People with diabetes often use a blood glucose meter to help them manage their condition. Whether you have a type 1 or type 2 diabetes at home, blood sugar monitoring device called glucometers can give you a valuable information. This is about whether your blood sugar is too low, too high, or in a good range for you. Thus, these portable electronic devices provide you with an instant feedback and let you know immediately what your blood sugar is.
Hello, this is the stepwise procedure for glucometer. To have easy flow of the procedure to be done, we must of course prepare all the necessary tools or equipment needed. Those are your monitoring device, test strip, lancet device, cotton, a monitoring diary, and a sharp bin. aka biohazard bin, for the used lancets and used test strips. Before operating the device, subject to be tested must wash their hands with warm water with soap and dry after. Warm water helps the puncture site give better blood flow, therefore it is easier to get a blood sample. Set up the lancet device by removing the cap. Insert the lancet following the grooves on the lancet device. Twist the circular cap of the lancet and expose the needle. After doing so, put back the cap of the lancet device and you should hear a click which indicates that the device is primed and ready for puncturing. Select the depth of how deep the needle will puncture the skin of the subject by rotating the depth indicator. Set the lancet device aside for now and prepare for the monitoring device. To turn it on, insert the test strip to the monitoring device. Inserting the test strip automatically turns on the device and it will tell you if it's ready to take samples. Place the lancet device firmly to the pad of your finger. Press the release button to prick your finger. Remove the device from the puncture site afterwards. Wipe the first drop of blood with clean cotton and use the second drop of blood for testing. If no blood appears, try applying light pressure to the puncture site to draw out blood. Write out the information gathered from the device to keep track of your records. Lastly is to clean the equipment after use. Throw all the cotton, lancet, and test strips to the sharp bin or biohazard bin. That is all and thank you for listening.
Okay, so good morning. I am Ning Balderas, and I wish you a Merry Christmas. So I'm here to present patient counseling about glucometer. So the way I'm doing this is like I'm talking to the patient na lang para it's quite direct or it's a practice na rin on how to counsel patients. So I would just say some important reminders kasi my groupmate already discussed the step-by-step procedure on how to use the device. So I'm just here to remind you of the essential information that you need about the device and about the usage of it and the results maybe. So yeah. First off, what glucometers are. So, baka nakailang ulit na sila. But I just want to reiterate. So, glucometers are usually small devices. They are used to monitor your blood glucose level whenever or wherever you are. So, syempre, pwede mo siyang gamitin sa bahay na kasi nga, that's the benefit of it. Usually when you go to the hospital, you could just request for a blood chem. But syempre, kung malayo ka sa hospital, gusto mo ngang i-monitor yung blood pressure mo, blood glucose levels mo, blood sugar levels, syempre, this is a device you could use. So, I would say na lang na if you're taking a blood sample from your body, I would suggest you do it sa fingertips. Now, if ever na may time na, kunyari, hindi mo, or walang lumalabas na dugo after you punctured it using the lancet, I would suggest that you massage your fingertips. So, any fingertips, but usually people take blood samples from the index finger. So, yeah, massage that. Then after massaging, so massaging helps to stimulate blood flow to that area. So yes, after massaging, rub it or clean it with rubbing alcohol. And then use the lancet to puncture it, get the blood sample. You already know that naman na. So, if ever na sabihin na natin yung device mo, it read that you have a low blood sugar level, pero hindi mo naman nararamdaman yung symptoms, like hindi ka naman nahihilo or whatever,
You could retake the test. Maybe the device or the strip is faulty lang. Pero sometimes you need to check the battery levels din kasi sometimes when the battery levels are low, medyo nagkaka-aberya na sa reading yung device. And of course, the strips. If they're expired, syempre, magkakamali talaga or magiging inaccurate talaga yung reading ng device. So, about the product, of course, kapag like any other product that you buy, you read the manual. So, it's important to read the manual. Why? Because it contains the interpretations din dun sa results or whatever warning lights or whatever codes na pwedeng lumabas dun sa glucometer, nandun siya sa manual. So, for you to understand what those mean, it's important for you to read the manual. Now, if you're a senior citizen na, of course, you have other people at home naman who could read it for you or who could explain it better, that would be better. Kasi at least mas maiintindihan mo kung paano siya gamitin. Next are strips usually have 3 to 6 months of shelf life before expiring. So yung strips usually they come in that small packaging naman. You saw it naman earlier. So usually they run out naman about less than a month siguro. Depends on how many times you check your blood levels in a day, but usually they don't last for 3 months. But if ever na, for example, you had yours for 3 months na and you still have some left, it's important to note that usually 3 to 6 months lang ang shelf life ng strips and you should buy them. And when buying strips, you should buy the specific ones made for your device kasi syempre baka magkamali kayo para dun pala sa ibang brand yung strips na yun. So, hindi gagana dun sa device ninyo. So, yeah. One thing to note, maybe dalhin nyo na lang yung glucometer nyo sa pharmacy and tell them na bibili ako ng strips para dito. Lancets are a one-time use. So, lancets yung needles. One-time use lang yan. So, I won't advise you to use it paulit-ulit. So, as Filipinos, we usually tend to use things na pwede pang magamit kasi nga medyo kuripot tayo. But yes, those are one-time use to avoid contamination na rin. And the effectivity kasi. Usually, when you use it once or maraming beses na, minsan nagiging mapurol na yung dulo. The sharpness of it is not that effective anymore. So, it may damage your skin at some point din. Next is storing the strips away from high heat or high temperatures and humidity. So, store the strips properly. Syempre, high temperatures and humidity can alter the strips and then interfere with the readings. So, yeah. Keep your results in record. So, syempre, kunyari you take your blood glucose levels 3 or 4 times a day. You should keep record of your blood glucose results. Syempre kasi that's when you would see if, for example, the medication or the diet regimen that you are doing is actually effective or not. So keeping your results in record eventually will help the physician then at least you kept record of it and yourself for you to see what adjustments you could do or what things you're doing wrong. Yeah. And then last, I would discuss about factors that may affect your blood glucose levels. So I only mentioned 2 here. I think these are the most common ones. So of course, food intake and medications that you take. For the food intake, we have carbohydrates. Carbohydrates like rice, bread, yan, yung mga carbs na sinasabi nila. I'm not saying that you should eliminate these from your diet since carbohydrates are still essential, but they are the main cause of having high glucose levels, especially rice. So, syempre, Filipino, alam niyo naman, we usually have rice in our diet, but I suggest you lessen it if you have a high glucose level. Bread, you could take bread, but they're very high in carbohydrates. And then, yes, sabi ko nga, lessen it. Fruits, on the other hand, yes, it is good to eat fruits and yan, marami tayong information about the benefits of eating fruits, but eating too much of it will eventually lead to a high glucose level. So, mataas na yung blood sugar mo niyan kasi fruits have very high sugar levels. Then, of course, sweets. Syempre, alam naman na natin yan. Candies, desserts, what else? Um, anything that's sweet, you must lessen it. I think you could eliminate sweets from your diet actually. But, uh, of course, syempre, hindi natin mapigilan. Gusto natin something matamis, but we should lessen it then. Because that will impact the results of your readings. Next would be medication. So, hypoglycemic drugs. Usually, ang napapansin ko na prescribe sa mga patients na may mataas na blood sugar levels are metformin. So, metformin is hypoglycemic drugs. Pinapababa niya yung blood sugar natin. So, that would affect your reading then. They have low tendency naman of making you making you hypoglycemic. Hindi ka magiging anemic naman. Hindi nila pinapababa masyado yung metformin. But yes, it will affect. So, baka mapansin nyo, it's lower than usual or like that. So, your medications will impact the readings. Last is insulin shots, of course. This will greatly affect your blood glucose levels. These have the tendency to make you anemic or hypoglycemic. So, keep that in mind. So, syempre, food intake, diet is very important. That's one factor. And medications. So, thank you for listening. Those are the information or important information I think you should know before using this product. I have to remind you again, please read the manual. If you have a hard time using the product, you could always ask family members for help. The manual is there. So, syempre, diet and medication affects your results. So, yes, I hope you have a beautiful Christmas. Keep our diets intact or in check. Kasi nga, Pasko na naman. Mahilig na naman tayong kumain ng kung ano-ano.
So for our new device research, we opted to choose a device photodynamic therapy. So photodynamic therapy, or PDT, also known as blue light therapy, is a non-invasive, highly selective method for the destruction of unwanted cells and tissues. It has three components: light, photosensitizer, and oxygen. So the main function of this device is to destroy the production of abnormal cells that may develop into cancer using a light-sensitive medicine and a light source. So this light source needs an activator called the photosensitizer or the light-sensitive medicine to cause a preferential localized damage to the areas that are trying to turn cancerous. So all the three components are harmless in the absence of light, but if it is present, it is only for targeted cells. So it can either be injected intravenously or put topically. Other benefits of photodynamic therapy include the following: killing acne-causing bacteria on the skin. It affects only targeted cells. So, as I've said a while ago, it produces localized damage to the areas of the skin that may turn cancerous. So, it limits the damage to healthy cells that helps maintain the skin's integrity. It reduces the size and activity of sebaceous glands. It helps fade old acne scars. It does not cause scarring. It can also treat other skin conditions that may occur alongside acne, such as age spots and rosacea. So, rosacea is a chronic inflammatory skin disorder. And for those patients who are allergic to antibiotics, or those who cannot take antibiotics or oral retinoids such as Accutane, good thing PDT does not involve the use of those medications. So it is a very viable treatment for people who cannot take those medications.